All right, thank you for joining us on this latest update from Public Health Services. I'm Communications Director Dan Hoost, and I'm pleased to be joined by Sullivan County Public Health Services Medical Director, Dr. Bruce Ellsweig, who is also a practicing physician at Crystal Rudd Healthcare. Bruce, thanks for joining us.
It's a pleasure to talk with you tonight.
So that's what we are going to talk about very briefly here about the Pfizer vaccine, which is the focus of our school-based clinics. Although most of our clinics were also offering Johnson, and at least one of them coming up, we're offering Moderna. But Pfizer, I think this is the largest rollout of it that we've had in Sullivan County since we started offering vaccines. I think that's because it's more available now. And also we wanted to focus on making sure that young people, as young as we're allowed to go, can get vaccinated. But I know that even though we are going to be allowing some parents, or we're going to have parents accompany their 16 and 17-year-olds to these clinics, they may still have questions about the efficacy and the safety of this vaccine in their teenagers. This isn't adults who are taking it and taking on the risk themselves. These are young people who have parents that continue to be their legal guardians. So what can you say about the Pfizer vaccine that might help answer some questions that parents have?
Well, all of the vaccines that are now available that have received emergency use authorization are incredibly safe. I have not seen any major reactions for the well over 10,000 doses that we've given to people and put in their arms in Sullivan County from public health. They're safe, they're effective. I know that there is some resistance to any kind of vaccination among some people, and some people are skeptical about a vaccine that has not received anything but emergency use authorization. But these are safe, they've been tested, and they're actually testing now children 6 months and older for the safety and efficacy of the vaccine. So soon to be released, I hope by the end of the summer or the fall, that we can actually immunize very young children as well. But I have not to this day seen any reasonable side effects that are something that would put a child or an adult at risk.
Is it something, though, that there could be some sort of underlying health condition that parents might want to check with their doctor ahead of time?
It's always wise to speak with their primary physician to make sure that there are no issues, but there are very, very few. Even it's approved and being given to pregnant women as well, and it has not been shown to have any effect on fertility or the unborn infant or the child after the child is born. So the vaccines are pretty uniformly safe from all of the data that we have from the clinical trials from the CDC and from the FDA.
And specifically with the Pfizer vaccine, is that given the same way the others are, where it's the shot in the arm?
Yes, it is.
But it's two doses, right?
2 doses. The only one that is not 2 doses is the Janssen or the Johnson & Johnson vaccine. That's a single dose, and that will be made available as well.
But that's not available.
There has been some recent controversy when the J&J vaccine was pulled off the market temporarily for the very rare side effect of clotting that was found in young women. But it was re-released because it's been found to be safe. It's much less likely to have a blood clot from the vaccine than it is to be struck by lightning.
Again, specific to the Pfizer vaccine, because I think that's the newest for us. Parents are going to come to these clinics along with their 16 and 17-year-olds. They give permission for the shot to be given. Do they then need to make sure that they accompany their child on the second time the shot is given? Or do they only have to give them on the first?
I believe that for any minor, they probably need to be present for both vaccinations.
Okay. And if they have any concerns when they're there, will they have somebody to speak to? I know you've been at a few of these clinics.
I try to be at as many clinics as possible. We have highly trained and effective clinical staff at each of the vaccine administration clinics, and they are prepared to answer questions. We try to have a physician or nurse practitioner clinician as well at the clinics when they're available. And I know that I'll be available on Wednesday for our clinic at the college, once again, for the second doses. And I'm also going to be available at Livingston Manor for the clinic at the school on Friday. So I try to make myself available on all of my time off so that I can be there and present to answer questions. But we do have other clinicians and volunteers that have been trained and are able to answer questions regarding the safety and efficacy of the vaccine. We do keep any recipient of the vaccine present for at least 15 minutes after the vaccine is administered so that we can look for any potential side effects. But truthfully, I've not seen anything of significance since we've been giving the vaccine. There are a lot of questions that have come up about people who have underlying illnesses or on other medications, and there are very few reasons not to get the vaccine. And if there are any questions when your child has a chronic illness or you feel that they may be vulnerable or they may have had a reaction to something in the past, please ask your primary clinician to answer that question for you before you come in for the vaccine. But this is the platform that the Pfizer vaccine and the Moderna vaccine are prepared on, is an mRNA vaccination platform. It's a totally different technology than traditional flu shots or any of the vaccines that we've given, like measles, mumps, rubella, et cetera, which are similar in their model to the J&J vaccine, that are modeled quite differently than the mRNA. And with this incredible technology it's actually been in the works for more than 10 years, but its first implementation with all of the research that has been done in the last 8 months or 9 months or 10 months since this has been an issue and they worked on it, it has not shown any side effects or any interaction with people who are sensitive to other vaccines in the past, because it's a different technology.
So since this, though, remains a voluntary vaccine, what would you say to a parent who is still on the fence about their child getting this, that it's been in development for a long time, but it is in some respects new to them, and they don't have to get it. So why get it now? Why not wait?
I think that the sooner that we get the vaccine in the arms of as many people as possible, the less likely we are to have variants, to have mutations. An unvaccinated child or adolescent or adult can act as a petri dish, a place where viruses can multiply and change. And this is where the variants or the mutations can occur. And so far, we've been very fortunate that the variants that exist, that have been identified throughout the world, seem to be fairly sensitive, and very sensitive actually, to the vaccines that we have. I know that they're working on boostering and manipulating the vaccines, the mRNA vaccines, so that they will be very effective against the variants that as they develop. So the more people we have vaccinated, the less likely we are to spread the disease, to allow the virus to mutate, to allow the virus to exist in people that can spread it to other people. And if children are asymptomatic when they get it, they still can give it to their parents, their grandparents, their great-grandparents, other vulnerable people in the community. So I think it's critically important, and it's an incredibly wonderful opportunity that we have when we vaccinate the children as well as the adults.
Right. I think that answers the questions I had. Was there anything else that you wanted to make sure people knew about?
In the meantime, I would reinforce the fact that we need to wear a mask, we need to practice social distancing, we need to wash our hands, we need to take all of the precautions that the CDC recommends. And very fortunately, for those people who have been vaccinated and are in contact with other vaccinated people, the rules have been relaxed, and they continue to be relaxed as for that population that is well immunized against the disease. But we still have a very large percentage of our population in the country that is not vaccinated and not protected. and therefore we afford them the opportunity to create new variants and spread the disease. So bear your arm, get a shot. In the meantime, practice social distancing, wearing your mask, washing your hands.
All right. Thank you, doctor, for your time. I appreciate it.
My pleasure. You have a good evening and stay safe.
You too.